Hi everyone. Prescription writing is one of the fundamental skill every doctor must know, and prescription writing is one of the commonly asked exercise in practical exam. So what are the correct way to write the prescription and what are the common mistake you must avoid, that we will learn in today's class. Prescription writing is important for the clear communication between the patient and doctor. Correct prescription writing will promote the rational use of the drug. So in today's class, we will discuss about the definition of the prescription, parts of the prescription, types of the prescription, legal requirement for the valid prescription, how you will handle the prescription, what are the common errors in the prescription that you must avoid while writing the prescription, and common abbreviations that is commonly used in the writing of prescription. So to begin with the history, the word prescription, it is derived from the Latin term prescriptus. Pre means before and scriber means to write. Prescription means to write before. Prescription need to be written before a drug could be compounded and it is administered to the patient. Now coming to the definition of the prescription. A prescription is a written order of a physician to the pharmacist with the details of the name and doses of the drugs, instructions for the preparations and dispensing for the pharmacist, and mode of administration for the patient. So to summarize, a prescription is a written order given by registered medical practitioner to the pharmacist to prepare and or dispense medicines for the use by the patient. So physician gives order to the pharmacist to prepare the drug, and pharmacist will dispense all these drugs to the patient. Now coming to the parts of the prescription. So there are four parts: superscription, which includes details of the doctor, patient and the symbol, which is known as treatment. Then inscription, which includes medication which is prescribed to the patient, and this is the main part of the prescription. Subscription, which include direction to the pharmacist. Signature or transcription, which include direction for the patient. Now coming to the superscription, that is the first part of prescription writing. So it includes details of the doctor, doctor's full name, qualification, address with the phone number and email. And along with this, you have to also write the registration number of the physician. Date of the prescription, that is also must to write. Details of the patient, full name, age, gender, address, phone number, body weight and the symbol treatment. So these are the parts of the superscription. Now coming to the importance of the superscription, why each and every detail you have to write when you are writing the prescription. So doctor's full name, qualification, address with the phone number and email, these all details will validate the prescription, and it also provides contact information to clarify if there is any questions from the patient or their relatives in case of emergency. Registration number is required because prescription is an medical legal document. So you have to always write correct registration number when you are writing the prescription. Now coming to the date. So date of prescription writing is important because it helps a pharmacist to find out the date of prescribing. It also helps to know when these medicines were last dispensed, if the prescription is brought for redispense, and this is particularly important for the long therapy like for the tuberculosis, leprosy, epilepsy. In all these cases, patient need lifelong drug treatment. So in this case, the date of the prescription is very important. Date is also important to monitor the progress of the therapy and also to check for the patient compliance. Date writing will prevent the misuse of Schedule X drug. So when you write the date of the prescription, then it can prevent the misuse of the drug like Schedule X drug. Now coming to the importance of the patient information. When you write the name of the patient, it is for the identification purpose. Age of the patient is important. For example, for child, the dose modification is required. So gender is written to avoid confusion when there are similar name. For example, viral, which can be the name of the both the male and female. Certain medicines are meant for the female, for example, oral contraceptive pills. Address of the patient is written In case of epidemic, number of the patients from the same disease from same area may come to you, and in that case you can trace the patient from the address of the patient if the patient does not come to the doctor for the follow up. So sometimes the phone number of the patient is also mentioned in the prescription so that the doctor can contact the patient's relative in case of emergency situations. Now this treatment symbol, it is from the Latin term and which is pronounced as recipe, means take thou or you take. So this represents a prayer to the Greek god Jupiter, which is meant for healing. And the meaning of this symbol is you take this medicament with the name of the god who may cure you. Now coming to the inscription part, full generic name of the drug in the capitals, it is mentioned in the inscription, dosage form, dose of the drug. Then the first drug which is always written in the inscription is the main medicine which is meant for the primary action. For example, in malaria, you will write lumefantrine or artemether drug, that is for the primary action for the treatment of malaria. Then the adjuvant medicine which helps or increase the action of the main medicine. Then comes the symptomatic or supportive or corrective medicine which can be the flavoring or sweetening agent also. Along with this, you have to also write if you have given the drug in the liquid form or semi-solid form like cream or ointment, or in the solid form, for example tablet or capsule. So when you are writing the drug in the inscription part, you have to also mention in which doses form you are administering this drug to the patient. So when writing the inscription, you have to prescribe it in the following order: first, injection form or the parenteral form; second will be your oral dosage form, capsule, tablet or liquid dosage form; and lastly the topical dosage form which is meant for the topical application. Now coming to the subscription part. Subscription is instruction to the pharmacist regarding preparation and dispensing of the medicine. So you have to write it clearly. For example, mix and prepare it, or divide it in 3 doses. So clear instruction to the pharmacist is necessary to avoid any confusion for dispensing of medicines. Now coming to the transcription. Transcription is a direction to the patient in local vernacular language regarding mode of administration of the medicine. So these include dosage form, dose, frequency, and timing of the administration, that is the dose interval, duration, and if there is any other instruction. For example, you have to write that take this medicine on empty stomach. Signature. Prescription must be signed by the prescriber by his own hand, and that will validate the prescription. So these are the parts of the prescription along with their importance. Now coming to the renewal instructions. Number of times a prescription needs to be repeated. It should be written by the physician. And this is particularly important for the Schedule X, which are highly addictive or substance abuse drugs, to prevent its misuse. Now coming to the legal requirement for the valid prescription. All the prescription which you write, it should be legible, unambiguous, means it should be very clear, dated and signed clearly for optimum communication between the prescriber, pharmacist and patient. Always space out the words and numbers to avoid the confusion, and complete medication orders. Avoid abbreviations if possible. Computerized prescription must be signed at the end with the help of physician's hand only. So these are the legal requirement for the valid prescription. Now coming to the abbreviations. So in the prescriptions, abbreviated terms can lead to misread or errors in interpretations by the pharmacist. So it is preferable to avoid such a misleading abbreviations to avoid errors in dispensing the medicines. For example, name of the drug, name of the some drugs, especially some brand names, may look or sound similar. So errors in the name of the drug can lead to the major prescribing errors to the patient. For example, L-throcine or L-troxine, Acidine or Apidine, Digoxin and Digitoxin. Writing sound like a drug can lead to the major prescribing error to the patient, and this you should always check for. Now coming to the strength of the preparations. Now the drugs are available in the different strengths. So drugs must not be dispensed if the strength is not written in the prescription. So paracetamol tablet 500 milligram, it should not be dispensed when no strength is mentioned in the prescription. So always write the correct strength of the prescription to avoid major errors in strength of the prescription. Now coming to the prescription error. So these are the common prescription error which you should always avoid when you are writing the prescription. The most common error is the illegible handwriting. If the pharmacist cannot read it properly, then it can lead to the errors in dispensing the medicines. So to prevent this dispensing or medication error, computerized prescriptions or prescriptions using the capital letters or tall man letters are routinely used nowadays. And to prevent this type of dispensing or medication error, nowadays pre-compounded prescriptions are used. So the common prescription errors are the incomplete prescribing errors, and sometimes when you have written gram, it can be mistaken for the milligram. So these are the common errors which you should always check for when you are writing the prescription. Now coming to the several abbreviation phrases which are the Latin terms, and these are commonly used in writing the prescription. So Latin terms, for example, the first one is OD, that is omni indi, and the meaning of this is once a day. Then BD, which means bis in die, and the meaning of this is twice a day. Then TID, which means ter in die, so that is thrice a day. QID or QD, that is quarter in die, which means 4 times a day. SOS, see opposite. So this means as and when required, the medicine can be taken. For example, paracetamol. Paracetamol is often used in the treatment of fever. So when there is a fever, you can take these medications. So often paracetamol is prescribed in terms of SOS. So when there is a fever, patient can take it. AC means anti-sebum. So this means before meal. PC is post-sebum. That means the medicine should be taken after meal. HS is ora somni. That means at the bedtime the drug should be taken. PO is peroral, that means the medicine should be taken by the mouth. State is stative, so that means at once the drug should be given to the patient. So these are the common abbreviations or Latin terms which are used while writing the prescription. If you like this video, subscribe my channel to watch more pharmacology related videos. Thank you.